Okay, welcome everyone to this webinar on population health objectives with Retain Unified Archiving. My name is Q Magus. I'm the Director of Product Marketing here at Guava, and we are pleased to be joined by Joe Feyerson from the CEO of Reach IPS. And so, yeah, we'll go ahead and turn the time over. The beginning of the presentation will be done by Joe, and then I will finish up. And so we'll go ahead and give the time to Joe. Joe, take it away.
Thanks. Good afternoon, everybody. Thank you for joining today. What if there was a way that your team, your clinical team, your business team, your operations team could use the very tools they use every single day, no learning curve, nothing different in the way they do the work, and your IT department didn't change the way they did business, but yet there was a way that you would be able to help drive many of the business and federal and state initiatives needed to help run your organization a little bit better. One of the really neat things we'll talk about a little bit here is that the most common tool used for communication in healthcare today is email. And one of the neat things that the Retain system has done is it'll provide some tool sets to enable your IT department as well as your business and clinical departments to be able to meet objectives, including population health, without any change to the way you do your business. So we'll go ahead and start with a little slide here, kind of give the next page here. So we understand that in the healthcare world, right, there's a lot of things happening here. In addition to just still trying to keep your EMRs running and everything talking to each other, you're going to a pay for quality-based methodology for a lot of the areas. Accountable care organizations are having to be created. And so you got population and mobile health initiatives. Telehealth is becoming more and more prevalent. And of course, the litigation and audits around that are going to be part of how do I validate, how do I prove that we're actually extending the care beyond the clinical walls for our patients on here. And of course, all this has to meet compliance with HIPAA, PCI, and high-tech regulations. As IT departments and compliance departments are always worried about the leakage of PHI and related information, so how do we make sure that we have mechanisms in place to help control that? And how do we corral ourselves around new forms of communication? Using email, social media, texting, mobile type applications and this stuff. Is there a way that we can leverage that information in such a way that it can actually help drive business and help reduce costs? And of course, federal and state funds exist as well. So accountable care, right? How do we reduce visits while increasing health? How do we prove that? Moving to a digital program. How do we eliminate as much paperwork as possible and be able to provide the reporting back? Is there a way using our very email system that we have right now that we can actually use it to help institute and help reduce all the special programs and special IT things you have to do to help make things work? And around that, it's all about population health. How do we meet the new initiatives coming in? How do we use that as part of our meaningful use and meaningful use 2 and 3 funding stages? And the big areas, and there's a big article today in the news, as of July 1st, behavioral health and mental health is now included in most of the insurance payments. As of Friday, met with the director of ONC, and now autism is for the first time legally considered a mental disorder. It's always kind of a right-on thing. So a lot of our customers who have behavioral health centers and behavioral health clinics are now able to, if they can prove that they can provide care outside of the clinical boundaries for autistic patients and other patients with mental and intellectual disorders, wouldn't that be pretty cool? And be able to get paid back for a lot of that. So we've developed in conjunction with Guava, an entire set of analytics that you guys can pull from your Guava system and be able to do some really neat things. Using email surveys, using setting up email groups, and the ability with the Guava system to be able to search, as do for an audit, for survey answers, for email addresses, for text and stuff. You can actually begin to create some really basic and some really neat analytics on the emails themselves, such as being able to say, hey, we have some population health based upon zip code, on different doctors, or upon looking at objective responses back to medication, or subjective based upon how the survey is set. What's also really neat, one of the things you can start doing with your own very email system is take that email and get this analytics and then can bring it back into your base program. So I can compare it now to my SOAP notes and to my EMR codes, ICD codes, and begin to actually do true across the board clinical analysis with the very email that we're using right now. So one of the byproducts of being able to use the Guava system is that we can pull that data, pull the text from that data, sift and sort it and parse it, and then integrate that back through your current EMR lab systems, HIS systems as well, and be able to use it as a tool to help you monitor and manage your outreach back to patients as they leave your clinic, leave your hospital. So that's kind of the back end of this for that. To get to there, one of the things you have to do is be able to, get the data at first. And one of the strengths of the Guava Retain system is really how it unifies and how it brings information in from the social media, from the emails, and from other types of devices. So at this point here, Q will kind of get into a little more detail in terms of how that all works.
Thanks, Joe, and thanks everyone once again for being here. Great information so far. That's exactly the point of what we're trying to make is, being able to use a tool that you already have with email to be able to get this information, to be able to get to it, and be able to access those funds and move to digital, right? And so what I wanted to touch on a little bit is how the system works. We'll get into a little more depth on how it works and how it can benefit you, because there's a lot to the Retain system and to archiving in general. And I mean, that's the idea, is that there's a lot of archiving solutions out there, and you can choose an archiving solution. However, the difference with Retain is that it has the ability to give you that insight into all of your communication data. It's more than just email. So on the the highest level is with Retain is it supports email and it archives email, and you can get a lot of information out of the Retain system because it archives email. It has that repository for all that information. And not only is it email, it's multi-platform email. So it supports Exchange, Office 365, Gmail, GroupWise. So the email system you're using, it's going to support. Furthermore, it supports social media and mobile communication. So as you implement different social media tools in your organization, whether that's Facebook or Twitter, whatever your doctors may be using or your other staff, you have the ability to view and archive what has been in that social media. And I'll touch on that in just a minute. And then, of course, mobile. Mobile's a big thing. Everyone's moving towards mobile. And so you'll have that ability to now, when you're using an iOS device or an Android device or a BlackBerry, you'll have oversight on that. And so that's how the Retain archiving solution on a high level works, and that's where it is different from these other archiving solutions, that it has all of these multiple types of communication in one central archive. And then, of course, you can get those insights from that archive, and you can get those analytics, as Joe was talking about, to really be able to see what is going on in your organization and what is going on with communication. So, and then going a little more granular with the email portion of it specifically, as I stated, there's mixed environment support. So if you're using multiple email systems, there's support for that. There are tools built into the system so that you can be able to easily search, find the messages that might be in the system that you're looking for, and you'll be able to export them to what is needed in the format that is needed, like a PDF or a standalone archive viewer. And the standalone archive viewer is fully indexed, and you can take that and hand that off to an outside team. What's great as well, and I'm going to show you that here, is as we were talking about, use a system that you're already familiar with. Retain actually replicates and the folder structure and the way that it's set up for an email system. So when a user goes into their archive, whether that's by accessing it through a plugin that's in their email system or via the web access viewer, they'll actually see exactly what they saw in their email system, so it looks familiar to them. And then from here you can do those searches to be able to find important information, be able to find the things that you're looking for, be able to prove that let's say that personal health information was communicated in a secure way, you'll be able to show that by doing a search quickly from here. And like I said, and Joe said, that you have the ability to quickly get insights and see what's going on in your organization quickly through that archive. Going a little deeper, there's the social media piece. What's great with the social media piece is you don't actually have to get the login credentials from your users to be able to access it. And now we're mainly talking that this social media piece is for the corporate side, right? So if you have corporate social accounts, whether that's an account for your hospital in general, or you have accounts that your doctors have that are specifically used for communicating with patients, you have the ability to archive that and put that into that central archive, and then of course be able to pull out information based on, as we are talking about, this public health initiatives. Because if you are now going out to your corporate social account for your hospital, let's say, and you can go and see what kind of interactions you have. You'll be able to really get a lot of data on what the population is going at. And Retain will be able to pull that all into this archive, and now you can see what's happening. You can get those analytics, which is amazing to be able to really get a feel for what's going on out there. And what's nice too about Retain is that there's alerts that you can set up. So if there's keywords, personal identifiable information, questions, if there's things that you want to know for sure as being said or happening, you can set up those alerts and they'll just come right in. And you'll get that alert saying, hey, this keyword, let's say it's about an initiative you have, this has been said, it comes up, you get an email about that, and now you can go and see what everybody is saying about that initiative, because now it's in Retain. That's now interacted with your social media accounts that are connected. And what's nice is, like I said, you don't have to get that login info. All you have to do is take the whatever account you're going to archive, the person just has to be logged into it, and then they just connect that. And then once it's connected to the archive, you don't have to worry about it anymore. It's now archived. And so some of the accounts that, as you can see here, that are supported are Pinterest, Instagram, LinkedIn, Google+, Twitter, Facebook, YouTube, Flickr, and Vimeo. And what's nice in particular with the two video ones that we're talking about, YouTube and Vimeo, it actually archives the video itself and any comments that go along with that. So once again, how valuable could that be for you to be able to see what videos your organization has posted, what comments have come along with that, and be able to gain those insights into that. I'll just show you really quickly a view. Here's a view of search in the social side of it. Specifically, you can search for certain terms, and you can specify which accounts you want to search, and you'll get those results back. And then, of course, with the work that Joe's doing, you'll be able to get those insights into what's going on with your social accounts. And here, once again, is a view of just how they'd connect to the different supported accounts. And so, once again, as that's being archived, you can get those alerts and you can be able to see what's going on and really be able to see via social media what's being communicated, how it's being communicated, and really get an idea of what the public health is saying. The final piece to this whole circle that we like to show a lot of here is the mobile piece. And as we all know, mobile is huge, right? It's been more and more people are using that, and they're using it in different ways, right? The evolution in mobile is that it used to be, as we all know, you were issued a pager, right? And that's how you'd get paged, and that's how you'd run and get things taken care of. And in the corporate world, there was different ways in which people were issued devices. So it evolved into there to where BlackBerry was given to a lot of people, right? And that kind of became the staple for many years for people to use a mobile device. And of course, there is a lot of compliance and controls in a BlackBerry, but now things have shifted a lot to where people are bringing their own phones, right? They're bringing their iPhones and their Androids. So how do you have that oversight? How do you see what's going on with what your staff is communicating on mobile if they're bringing their own phone? And that's where the Retain solution comes in and really gives you some help here, and that is that you have the ability to now have oversight on those communications. Of course, it works with BlackBerry, and Retain integrates directly with the BlackBerry Enterprise Service. So if you're using BlackBerries, that's the most seamless way to do it, because now they're using their phone, the BlackBerry phones, and communicating that way. And then, of course, Retain takes that information and pulls it down, and it looks seamless to the users. However, if you have people that are bringing their own phones, like I said, an iOS or an Android device, there's actually a separate app that you can put on those phones. So now the people can communicate, your employees can communicate via that app, and it assigns a separate business number to the phone. So now they can text and they can call using that app. And then everything they do there is now logged and archived in Retain. And it's also secure and encrypted. So if you've got a user to a user, one employee communicating with another employee, that's all encrypted and secure, both with their phone calls and their texting. If it's outside of the employer, outside of your workplace, so if a person is calling somebody who's outside that isn't part of this system, it's secure and encrypted up to the point that it hits the carrier, and then now it's not encrypted anymore. But those logs are still there, and if it's a text outside of, not employee to employee, it's employee to, say, a customer or a patient. Now those are still going to be logged in Retain, but they're not encrypted all the way across from end to end. So that is the way in which you can still let your employees bring their own devices, but they can use the personal side for their personal things, and then they can use the business side for their business communication. There's a couple of other ways you can do this as well. If you are issuing everybody iPhones, you can still use this app that we're talking about to assign a separate mobile business number, and you can actually shut down either at the carrier level or using an MDM, a mobile device management solution, to shut down the native dialing and texting, iMessage. So that's a pretty common practice that people do if they are issuing devices. So this is something to take into consideration. Also, if you're using Android, there is a separate way of archiving it, just using Retain and not using that app, where it actually pulls everything native from the Android phone. So if you're not looking for something with a dual persona, there is an option to be able to just pull everything down. Finally, there's another piece to the Retain Mobile, and that's mobile call recording. We have the ability, this is once again through an app that's placed on the phone, so that all the mobile calls that are done, you can specify how that's done, can be recorded and archived as well. Once again, giving you that oversight and giving you that insight into what's going on in your organization and how your employees are communicating. And so that's really the idea here, especially with the dual persona thing that we're talking about, is it's developed to support compliance, making sure you're compliant with HIPAA and high tech, making sure that you have the ability to communicate, and your doctors have the ability to communicate, and other staff, in an encrypted and secure way. And the other thing too is there is actually a feature of the dual persona where you actually have a critical messaging and pager replacement will actually override the silent mode. So you can actually have it as a pager replacement, to where your doctors can be able to carry around one device. If there's a critical need, it will actually override their silence, and it will come through. And then now you have the ability to have oversight and archiving of those as well. So really, that's the idea here with that dual persona that we're talking about and the Retain Mobile solution, is once again to have a complete view of everything that's going on with communication in your organization. We know people are changing the way they communicate. So as they're communicating with their iPhone, with their Android device, with email, which everyone's using, right? And even with social media, you have the ability to see what's happening, to be able to have oversight on those communications. And then here, once again, as I stated, here's a search, the complete search. So the other one I was showing was just the social media side. This one gives you the search of the entire archive. So if you want to be able to see everything in one central view, this is where you would do that. And what's great is you can search, get in those results, see what's happening. If you're looking for a certain term, or maybe it's about a certain project that you're working on, you can do that search. You can select those messages. You can export them, and even hand those off to another team if you want to, if they don't need to be able to access the entire archive. Um, with that, as I stated before, that standalone archive viewer, which is fully indexed and can be placed on any machine. You could put it onto a portable drive like a DVD or a flash drive, or even place it on Dropbox to be able to access that for teams that you don't want necessarily accessing your entire archive. And then here, once again, a little bit more with the search. So there's an auto suggest in the search. So as you start typing in a search term, it's going to give you instant results, and it's going to highlight the terms as you're searching them. And you can now specify the scope and the source and the date range for those searches to be able to get a quick feel of all the types of communication that are going on. And as I stated earlier, on the email side of it is we try to make it easy for your users to access it. So there is a plugin right in Outlook, so that if your users want to access the archive, they can do that directly from Outlook. They just hit the retain icon there, and they can now get to the archive directly from Outlook. And they can do a search directly from there as well, without ever having to go to the web viewer. But if they do want to access the web viewer, as I've showed you before, there is a single sign-on, so they can do that as well. And then just to finish up, once again, the biggest part of everything we've said is to be able to get insight into what is happening in your organization. And this is what we like to call the archiving 2.0. And I'll just reiterate what we said before. There's a lot of archiving solutions on the market, but the advantage with Retain is the ability to archive all of those many types of communications, the types of communications that your organization is using now, and to be able to get those insights into what is happening out in the population, what is happening with your patients, and be able to view that, as Joe showed before, in a quick view, and be able to gauge what is happening. So that's it for Retain. That's how it works, how it can help you. We're going to go ahead and look and see if there's some questions. Thanks again, everyone, for being here and for your participation. We hope you enjoyed this, and would like to thank Joe once again for being here with us and for the information he presented.
Yeah, so just to kind of thank you, Q. So to iterate, guys, this is Joe again. It's a single solution for your IT department that, in addition to being able to acquire data in text and voice strings from multiple devices and multiple mechanisms, provides clinical and business insight back for different initiatives. Everything from, hey, I want to search for PCI, I can put a template in for PCI or for HIPAA violations and get flags back on it, to I can actually take that information and create some great analytical reports and dashboards around it. It's the only solution that provides that full comprehensive part without changing the way that your users do business. Everybody is known for 20 years now how to do email, so let's not have to learn something new. They know how to use Facebook, they know how to use Twitter. Let's leverage those things the best way we can to help your business run better and get more information.
Once again, everyone, thanks for being here, and especially like to thank Joe for his time and for the information presented. Thanks, everyone, and hope to see you on the next one.